Welcome, doctors. Let's be honest for a second, when most people hear the term medical assistants, their minds immediately jump to doctors and nurses. Maybe a front desk person or two. But there's a whole group working quietly behind the scenes that's changing the way healthcare works every single day. I'm talking about virtual medical assistants. Now, I know, some folks think a virtual assistant is just someone answering phones from home. But in reality, they're the backbone of efficient, modern healthcare. These aren't just call handlers. These are trained professionals who manage patient intake, insurance verifications, appointment scheduling, even clinical workflows, and they do it all remotely. And you know what? Without them, many practices, maybe even yours, would be drowning in delays and inefficiencies. I've heard people say, we didn't even realize how much we needed help until we were knee-deep in admin chaos. Virtual medical assistants aren't just helpful. They're essential. Let's talk about what they really do. Day in and day out, these VAS are handling patient inquiries, scheduling and rescheduling, verifying insurance, tracking down pre-authorizations, managing follow-ups, organizing records, all while staying HIPAA compliant. It's a high-pressure job. But they do it so well, you only really notice their value when things don't go right. One virtual assistant said it perfectly: every task feels important, and the best part is seeing the direct impact on patient care, and honestly, that's what we all want. But let's flip the coin for a second and talk about the cost, the human cost, of inefficiency. When you don't have a system in place, or you're understaffed, your patients feel it. Appointments run late. Calls go unanswered. Referrals get lost. Staff get burned out. And while patients may not see the chaos behind the scenes, they definitely feel it when things go sideways. So why do so many clinics still overlook virtual assistants? 3 reasons come up again and again. 1. They're remote, so their impact isn't always visible. 2. They're seen as a nice-to-have instead of a necessity. And 3. People assume they're too expensive. But here's the kicker: inefficiency costs more than hiring help ever will. Every missed call? That's a potential lost appointment. Every hour spent verifying insurance manually? That's an hour a provider isn't focused on care. And every burned-out team member? That's a risk to patient satisfaction and your clinic's bottom line. The truth is, virtual medical assistants don't just save time, they help you save money, retain staff, and give patients a better experience. One practice told us, outsourcing those routine admin tasks gave our team the space to breathe, and our patient care actually improved. So, what's the smart move here? It's simple. Start outsourcing the routine, the insurance checks, the scheduling, the pre-auths. Let trained virtual assistants from trusted partners like Staffingly, Inc. handle those. Next, look into automating the repetitive workflows. Prescription refills, reminder calls, even record management, all of it can be handled smarter. And finally, make sure your team feels supported. When the admin load lightens, your staff can get back to what they do best, caring for patients. Here's the bottom line, doctors. Virtual medical assistants aren't a luxury anymore, they're a necessity. They reduce burnout. They improve accuracy. They make your clinic run like it should. And they're more affordable and impactful than most people realize. So if you've been on the fence, now's the time to rethink what support can really look like. Because when things are running smoothly, that's not luck. That's the power of having the right help in the right place. Thanks for listening, doctors. And if you're ready to explore real solutions for your clinic, you know who to call: Staffingly, Inc.